My name is Diana Bickle, and I am happy to give my statement for Dr. Kukurin to use.
Great, thank you so much.
What brought me in to see him was that I was experiencing a lot of pain in my hands and feet from neuropathy. I have stage 4 breast cancer. I've had 2 rounds of chemo, and about 3 months after my second round of chemo ended, I started getting sort of the numbness and the tingling, which, it was okay. But about 6 weeks before I came to his office, the pain got excruciating. It was running up my hands to my elbows. I tried ibuprofen, aspirin. I'm on morphine for other types of pain. Vicodin. I went to the higher level stuff. I mean, nothing helped me, and I wasn't able to sleep at night. And talking to my oncologist and my doctor my spinal doctor, they wanted to refer me to a neurologist, which was fine, but I couldn't get in to see the neurologist for like another 4 or 5 weeks, and no one had any answer for my pain except perhaps to take some of the new drugs that are out there. And I didn't really want to do that. I've had so many side effects from so much other medication. I didn't really think more medication. And really, they told me the only thing it was going to do was mask the pain and not really get rid of it. My oncologist literally said, well, you'll still have it, but you won't care. I had seen Dr. Kukurin before I had cancer. In fact, he's the one who, in the first place, helped me diagnose my cancer. 6 months with other doctors. He literally saved my life. Mm. So I decided to come back here, and I told him about my neuropathy, and he right away had a couple of things that we could try. So he wanted to have my information. He studied it for a week, and when I came back to see him again, we decided on a treatment for me. And the treatment was what was it called? Let me get the right words for it. Transcranial direct current stimulation. It basically turned out to be a very simple process. It's a matter of putting some electrodes on your forehead, and of course I'm sure there's some very detailed stuff that goes on behind the scenes, but from my perspective, that's pretty much what it was. Laying down and having this treatment for 10 minutes, which basically felt like someone tickling your hair. The next day I got up and there was no pain. I mean, I literally had no pain, no numbness, no tingling. It was such a huge relief. You have no idea. I was just like, I was so excited. And so the initial treatment is 5 sessions of 10 minutes, 5 days in a row, which I went ahead and did. And after that, you do follow-up treatments every week or so. And I did that, and since then, I've had no pain. I haven't had a treatment now in almost a month, and I still am experiencing no pain or numbness in my feet or hands, and it's wonderful. Well, the other doctors pretty much didn't help me, other than trying to prescribe another drug. That was their sole answer. I mean, that was the one singular answer that I got over the course of several different doctors in several different disciplines. I felt like when I came here that my neuropathy was a bad thing. I felt like neuropathy pain was something that was going wrong in my system, and what I found out from Dr. Kukurin as he explained how neuropathy works and what it was, in addition to helping me get rid of the pain, we also talked about treatments, supplements, things that I could eat or do that would help me get those new nerves to what he called mature, which would allow them to, on their own, reattach to the sensory places in your fingers, which is ultimately what you want, because that's healing. That's your body healing itself. Exactly. The pain that I was in before I came here, I was probably close to 6 to 8 weeks. I mean, it was getting unbearable. It was really to the point where it was unbearable, and I've learned to take a lot of pain, throughout, because my breast cancer has metastasized into my spine. I've had several spinal, they're collapses really. Basically, I've lost 2 inches in height. So I've learned to experience a lot of pain, and this neuropathy pain was as bad as any of the other pain I've experienced. And I think only people who have been there, and felt that understand. But you kind of, when you first get that pain, you can kind of embrace it. You're prepared for it and you can deal with it. But it wears you down over time. And I was kind of at the end of my rope when I got here. So today I'm fabulously happy. As a matter of fact, I was just standing out in the lobby and I was able to stand up sort of straight for the first time in 2 years, literally. I can do my knitting. I did cross stitch last night with my hands. I've been sewing. I've been doing genealogical research on the computer. All things that I use my hands for, and I really appreciate them now, because having a couple of months without them, without being able to use it, turn the knob on a door, without being able to open the car door to get myself in. I use a walking pole to walk with. I couldn't even grip that, to hold myself up to walk. You kind of take all those things for granted. And now, I do them without thinking, and I have to stop and remind myself today, oh my gosh, look, you're doing this. You're picking something up. You're grabbing a jug. You have strength in your hands. And it's wonderful. I feel fantastic. I would tell them, definitely come and try it. I know that the treatment itself, it's not guaranteed for everyone. It doesn't work the same for everyone. It worked fantastic for me, and for that I'm eternally grateful. Your insurance doesn't cover it, so you have to be prepared for that. But when you're in the pain, as I know some of you are out there, you would pretty much crawl across broken glass to get relief. And if this works for you, it is such an easy fix. And it's just such an easy fix. You don't have to remember to take anything. It just works. And definitely try it. Well, just that you'll love the staff here. They're all very friendly, and it's a wonderful, caring environment. I do feel cared for here, and I feel like Dr. Kukurin has addressed not only my neuropathy problems, but other problems that I've been having. And so I feel like I'm getting a kind of a whole body solution, which I find very appealing, and it's working, and I'm very happy.
Thank you, Diane.
You're welcome.